All right. So one of the things that patients sometimes perhaps don't understand is they think that, a melanoma diagnosis can be as black and white. And, when a dermatologist do a biopsy, the tissue gets dropped into the bottle, and a week later, the patient gets a call. They say it's a melanoma, it's not a melanoma, right? And I think in reality, it's much more complicated than that. And I see you nodding. Why is that? Can you tell us, like, what should a layperson, what do they need to know? Why is it's not a binary black and white event?
Sure. I think the first complication about it that many members of the public don't understand, and honestly, many people in the medical field don't fully understand, is what happens inside the pathology laboratory. So pathologists are doctors who look at tissue samples and other types of samples and examine them either microscopically, like in my case, or with other types of instruments in different parts of pathology. And we are the doctors who run the laboratory. And so, you may think like a blood sample, you take some blood and put in a machine, and the machine gives you all the numbers of what your values are, your cholesterol or whatever, right? Even that is a little bit more complicated because a lot of people have to make sure the machines are running the right way. But when we look at tissue samples, like a biopsy, like your dermatologist would take, it's not done that way. We don't just plop the tissue into a machine and the machine spits out an answer, melanoma, malignant, or benign mole. It's not like that at all. In fact, we have a whole team of people that go through different steps of taking that tissue and converting it into a little glass slide with a thin slice of tissue that's colored a certain way that allows me or other pathologists to look at it under the microscope and figure out what cells are there and if they're normal cells or not normal cells. And we do that looking with a microscope, just like this one right here, a light microscope, and looking at tissue slices under the microscope is kind of the same way it's been done for maybe over 100 years. Obviously, we've improved some parts of it, but that part of it takes a lot of manual steps. And that's part of what takes some time to have it done, is that the tissue has to get soaked in that little solution of formaldehyde or formalin. And then we have to cut it and measure it. And then we soak it in a series of different chemicals and embed it in a little block of wax. And then some very skilled techs in the lab called histotechnologists, they take that embedded piece of wax, they're the ones who do the embedding, and then they put it on a machine with a little razor blade that slices a 4 micrometer slice, 4 microns, like a little salami slice, only way thinner than paper. And they float that on a bath, scoop it up on the slide, and then they dip it into the different dyes and chemicals that give it the color that let me see it. And then I have to interpret it based on all of the training I've done of looking at normal tissue and abnormal tissue. And I have to figure out, is this normal or not? And if it's not normal, what's wrong with it? And if it's bad, if it's malignant, if it's melanoma or a nevus. So that's the biggest thing, is all those steps take a lot of work and time. And there's some degree of subjectivity in the process. Most of the time we can look at a slide and really quickly decide this is cancer or not cancer. But sometimes there's a gray zone in the middle where we're not sure and we have to do extra steps to work it up. And we'll probably talk about some of that in a minute. But there's a lot of different steps that go into it and require a lot of people that have a lot of training to make it all work the right way.
No,
So that's what's happening behind the scenes in the lab. It is a bit more complicated than just the black box that sometimes people think it is.
No, I love the way you explained it, and then all those intricate details, and talking about formalin and the sectioning the slides, and then also floating it in the bath, and then
Yeah. And I forgot, I have a short video on my YouTube channel. I can either send the link to Dr. Wong, or you can just search my name, Jared Gardner, and look up what happens to biopsy in the laboratory. And it's a short video that shows some basic steps, those steps I just talked about. If you're curious about like what actually happens when your skin sample goes to the lab, that'll show you kind of from start to finish how we do that process.
Yeah, I will definitely add that as a part of the sections
Cool.
of the video, so people can get a much better visual sense of what the process. So bottom line is, there's a lot of people involved in the process. That's what takes the time for the diagnosis to come back. But you also said this is not just like a machine reading it. There's subjectivity. Right. There's a human being behind it. A dermatopathologist, a pathologist.
Yeah, my brain is the machine. I'm looking at it through the microscope, and then I have to make a decision of what's going on, and if there's something abnormal there, and what the abnormality is, and if it's melanoma or something else. So yeah, it takes a lot of training to be able to do that. Obviously, you have to look at lots and lots of cases to be able to learn what's normal and what's not normal.
Yeah. And I think this is a very, very important point in my book when I was talking to people about the 5 steps when they first get diagnosed as melanoma. They really need to find out the accuracy of the pathology, right? And also who's reading it, the confidence behind this read. And it's not only, I think, it's accuracy, but the confidence of the people behind it. Can you